Welcome back, everyone. On this session, we're going to talk about what's considered postgraduate training. So in previous sessions, we talked about what's MRP, what's not MRP. We already talked about the difference between a training position, an assessment position, and a job position. And I also explained the gap. On this session, I want you to understand what is considered postgraduate training. Now, why is this important? Because this requirement will come up very frequently, and a lot of you do not understand very well what is considered postgraduate training in Canada and what's not considered postgraduate training. I had this doubt myself when I started my journey here, and now that I know a little bit more about the process, I want to make sure that you also understand what's postgraduate training and what's not considered postgraduate training, okay? So, usually, the one that is easy to understand is everything that you did in terms of clinical training after you had your MD degree or your MBBS will usually be considered postgraduate training, okay? Now, to be considered postgraduate training, it has to be a formal program, okay? So it has to be a training position. Usually it's called a residency program. And the residency programs that are official linked to a educational institution or a government body and that, will lead to certification is easily accepted as postgraduate training, okay? Now, if you did internship after having the MD or the MBBS and it was an official program where you had rotations, you were being evaluated and assessed, and at the end of that internship you have a certificate of completion of internship, that is also considered postgraduate training, okay? That one will be postgraduate training internship, and you have postgraduate training residency, which is the one that we talked about before. As I mentioned, postgraduate training usually also involves fellowship programs, except for through the lens of Alberta. But for most of the provinces and most of the people in the medical education field, fellowships are also considered postgraduate education, okay? Now, where does this become a little bit of a gray zone and that people don't understand very well? This happens when we're talking about internships that happened during medical school or before you achieved your MD degree. So in some situations that might be considered postgraduate training, but in other situations it might not. So that's why it's so confusing, okay? If you did a 3 or 4 year program, so if you did, for example, medical school in the Caribbean or in Canada or in the US, they do not involve internship. Those rotations you do on the 3rd and 4th year are mandatory or elective rotations of your medical school, and they do not constitute internship. Now, if you come from a country where medical school was 6 or 7 years, and sometimes even 5 years or 5 years and a half, and you had an additional year at the end, sometimes 2 years, where you were not only doing your elective rotations, you were seeing patients and you were trying to reach diagnosis and you were trying to come up with management plans that were then endorsed by a supervisor under close or distant supervision, that is an internship. And if you're able to pull your medical school transcript and prove that you did those rotations into different areas, and that it was a formal training program where you were evaluated and assessed and led to certification in the sense of led to a completion of internship and led to your MD program, that will usually be accepted as postgraduate training, okay? Now, even though there are internships that are 6 months, 1 year, 1 year and a half, or 2 years, many times when you're applying for certain assessments of your training history, internships are limited to 1 year in the sense that sometimes, even though you did 2 years of internship, only 1 year really counts towards the sum of years that will be considered as your postgraduate training. Okay, so this needs to be taken in consideration. It doesn't mean that because you did 18 months or 2 years of internship, that depending on the place you apply. So if you apply for a practice ready assessment, or if you apply for the Practice Eligibility Route with the Royal College of Physicians and Surgeons of Canada, that they will consider the entirety of your internship as being postgraduate training. However, most of the institutions and in most of the cases, up to 1 year of that period may count as postgraduate training if they meet the criteria that I described, okay? In addition to the criteria that I described, they will usually need to look into what rotations you did during your internship. So they're gonna want to know if you did pediatrics, obstetrics and gynecology, general surgery, and internal medicine, for example. Those are the four most common ones. In addition, very frequently, you will have done public health, psychiatry, and emergency medicine, for example. Some internship will allow you to rotate in certain other specialties. So all this will need to be listed on your medical school transcript or your completion of internship transcript, okay? So make sure that these are all listed. Look into your medical school transcript, see how it's listed as well. If it says internship, that makes it much easier when you're applying for a program to consider that as postgraduate training. And why is this so important? Because I have talked to countless IMGs that come to me and say, I have no postgraduate training. And then I ask them, okay, where did you do medical school? And then they'll tell me a country where I know that their medical school is 6 or 7 years. And I know that they did their internship on their last year. And when I ask, they will say, oh yeah, of course, I did an internship on the last year. So when they tell me that, I have to tell them that in Canada, that last year might be considered 1 year of postgraduate training. And that is crucial information that I'm giving you. Because with that information, and when I talk about the licenses, you might realize that you're eligible for practice-ready assessments that lead to full licensure without having to do residency again in Canada. Can you imagine that you might be only applying to a residency program while you're eligible to apply for something that may give you a license after only 3 months of assessment? So it is very powerful. Information, knowledge, and knowing the rules of the game can be extremely powerful. And I'm trying to give this strength, this ability to you of making informed decisions, okay? So now you're gonna look into your training, you're gonna look at how much you have in terms of internship, you're gonna look how many years you have of residency, and you're gonna look how many years you have of fellowship training, okay? Now, when we're talking about fellowship training or subspecialty training, they're usually considered postgraduate training, but they don't always count towards what you're trying to achieve. So I'll give you an example. If you have someone who did pediatrics after doing a 6-year program, but they only did 2 years of residency in pediatrics, and then they did another 2 years of a subspecialty in pediatrics. If you analyze their CV, they have 5 years of postgraduate training, correct? They have 1 year of internship, 2 years of pediatrics, and then 2 years of subspecialty training. They might even have 1 year of fellowship, which makes it 6 years of postgraduate training. However, if they submit an application to the Royal College of Physicians and Surgeons to analyze their training towards whether or not they're able to be considered to sit the board exam in Canada as a pediatrician, the board exam, the Royal College, will most likely deny their application. Why? Because they might say that they need 4 years of residency training in PEDS itself. So sometimes they count the internship, sometimes they don't. It depends on the specialty. And I will talk about this in more detail when we talk about the specialist pathways. So some specialties accept internship, some don't. Some of them will accept fellowship, some will not. And some of them will even accept research, master's, or PhD. But it greatly varies in what specialty you're applying for. So although all this might be considered postgraduate training, every situation that I talked about here, you will need to understand when we talk about the eligibility requirements for each of the licenses if that postgraduate training you have will or will not qualify towards the license that you are applying for. Okay? So again, I want to explain the concept so that when we go talk about all the licenses, you know very well what I'm talking about and you are clear in the concept before I start talking about the eligibility requirements, okay? So I will help you in a different session. I will help you organize all the information regarding your training so that you have a template with all the information even before I start talking about all the licenses. That will allow you to understand when I talk about the licenses very quickly if you're eligible or not for them. And if you're not eligible, you will know exactly why and what you can do to change that. So if you like this session, let me know in the comments. But if you also have questions and you want to ask something that was not clear to you, please make sure to add it on the comments and we will be more than happy to read them and make sure that we get back to you. Okay? So I will see you on our next session.